Here we go. And any recordings I do on Skype, you won't find on Blackboard Collaborate, of course. It'll be on YouTube. All right. I'll give it a couple minutes just see if anybody else is joining us. That's right at 4 o'clock. What the heck happened? All right, so I would think by now people will probably be coming in later. All right, ladies. So first off, is there any questions I can answer? And I know y'all have probably not read the peds, or if you have started it, I'm guarantee you haven't finished it or listened to them, so you might not even know what questions to ask yet. But is there anything you have difficulty with or questions with? It is, and it's really heavy on the beginning, or it feels really heavy in the beginning because, like that first lecture, for example, the first two recordings, it talks a lot about pediatric adaptations. It talks about assessment. It talks about interventions. It talks about some of your sensory disorders, like autism, for example, and blindness and all this stuff. But once you get into it and you start to study it, you realize a lot of it is not as in depth as it seems. So it's a lot of content wise, but a lot of it is also stuff you've had before at some point in some level. A lot of safety stuff, like, well, and those of you that are in the night class, we haven't talked yet, but tonight we'll talk about it when we get there. Safety stuff as far as ingestions and, the baby gates and not putting them on raised surfaces, all that kind of stuff. So some of it is a little more common sense or things you've learned before, like in fundamentals or whatnot, and it seems like a lot, but it's not as much. Now, the information we'll be covering after the third exam, the final exam, that one does get quite a bit more in depth. Like we talk about a lot of GI, GU disorders that you're not going to see in adults necessarily. So as far as system disorders, it gets more in depth after the third exam. As far as how exams go in severity, exam 3 is always my highest scoring exam. People typically do very well on exam 3 as long as they prepare for it. Now, usually what hurts people on exam 3, that first pediatric exam, is growth and development. The people that don't do well on the third exam come back and tell me they didn't do well because they didn't go back and review their growth and development information, and that's what hurts them. They go in thinking that they've already learned this, so so they know it, and then realize going in that they've forgotten some of it. But people that do take the time to review growth and development, typically the third exam goes very well. So if that gives you any kind of hope at the end of the tunnel in the next few weeks, just don't forget about growth and development. And I guarantee you, when you start reading about growth and development, a lot of it's going to come back to you. Even if you don't remember the details, you're going to remember, oh, yes, I remember talking about Piaget, for example. But make sure you do go back and review it. And then, like neuro, there are several things we talk about that you've talked about before, like meningitis, seizures. I feel like there's something else in neuro. Those are two of the big ones. We talk about a lot of the stuff that we talk about in neuro has similar symptoms because they're related to the increased intracranial pressure. And then like musculoskeletal, for example, it's going to be no different with them versus what you talked about in adults, like signs of osteomyelitis and prevention of it and fractures and all that stuff. We don't really go into musculoskeletal in depth too much. We kind of just gloss over it. Because there's really nothing. But actually, no. The only new thing I can think of that we talk about musculoskeletal really is growth plates. So if you have a fracture on a growth plate or an epiphyseal plate, how that's more significant than a fracture somewhere else, because that's where their long bones grow. And if you have fractures there, it can inhibit growth in that bone, which adults don't have growth plates. Their bones have finished forming. So that's really the only thing we focus on that's different with children versus adults as far as musculoskeletal. But it is a lot of content, but at least for exam 3, a lot of it is going to be stuff you've talked about before somewhere, either lifespan, fundamentals, some med surge. So keep hope. Yeah, absolutely. Good question, Kathy. Hold on, I'm just writing down as y'all come in. Who's here? So let's talk about urine collection. And for those of you in the night class, we'll be talking about this again in class, but I want to go over it again. So urine collection in a child, if they're old enough to be potty trained, we do it just like an adult. We do a clean catch. When we have a child that is not potty trained, though, we have to collect that urine in another means. And there's 3 kind of ways that we do it. One way is called a urine bag, or a U bag. You'll hear it called sometimes, U for urine. And it looks like, do I still have that pulled up, I wonder? Where I can show you all the picture? I might even have another picture. This one here. There we go. It is on y'all, so share this. Where is it? I'm just going to share my desktop because Skype acts funny when I try to share files. Not what I want. This is what I want. So, this picture you see up here, this top picture, that's of course a swab. But this picture up here is a urine bag, and I know it's kind of hard to see it, this plastic bag you see. It's about the size of like a sandwich bag or so, maybe a little bit bigger. And there's an opening on one side. There's a hole on the end, and around that hole is a sticky surface. And that sticky surface, you peel off the layer, and you can stick that either around the base of the penis so that the penis is inside the bag, or you take and lay it across the labia and kind of V it in so that it will, as they pee, it will drain into that bag. We don't like these devices in practice. I know your book talks about it being a great method, but in practice, we avoid these unless we absolutely have to use them. One, they're messy. A lot of times they fall off, they leak, they don't collect a good specimen. We hate them. If you don't have another option, they work okay, but they're not optimal. So we will use these to collect urines if we don't need a sterile specimen, maybe if we're just doing like a urinalysis or something like that. They're okay. Or I've had instances where I couldn't cath them for whatever reason, and this would work where they can pee into it, but it's messy and it doesn't always work as well as we like, and it's not sterile. So if you collect a specimen in one of those bags and it comes back positive for if you do a culture and it comes back positive, then you're going to have to straight cath them anyway, because you don't know if it was the bag that was contaminated or if their urine was actually positive. So if we need a culture, we just do a straight cath. So where you take the catheter and you insert the catheter long enough to drain the bladder and pull the catheter back out. And I have a kit in my office that I normally show y'all, except I forgot to have my husband grab that when he went and got my stuff from my office yesterday. So I don't have it with me. But the catheters, they come in a kit. It has a little tube that it's attached to, that the catheter is inside. It drains into the tube like a big test tube, and it keeps it all together. All your supplies are there. The catheters that we use in peds are super tiny. We use either a 5 French or an 8 French when we're talking about little children like that. So a 5 French would be about like an insert on a pen. I got a pen in my hand, actually. No, that would be more like a, that would be more, and I know it looks huge on the camera the way I'm holding it, but that's closer to an 8 French. So a 5 French is even smaller than that. So they're pretty small catheters, and usually they're only upset because we're holding them down. Where was I going? Oh, cathing. So cathing, we use the straight cath if we need something that's sterile, or even a larger amount of urine, like a culture, for example. The third method that most people have not heard of is called the cotton ball method, and it's very straightforward. The reason it's called the cotton ball method is because we put cotton balls in their diaper to collect the urine. So this is good for when we need small, frequent amounts of urine. So the example I gave in class today, which is the most common reason I've done these, usually is patients on chemotherapy. Patients on chemotherapy, we're supposed to check every single urine that they have for specific gravity, pH, blood, that kind of stuff. And we're not going to be putting a bag on them to stay on constantly, and we're not going to be doing a straight cath. So we put cotton balls in their diaper. You just take a wad of cotton balls in your hand, stick it in the front of their diaper, near their penis if they're a boy, near their urethra if they're a girl, of course, and then when they pee, when you take them out of the diaper, the urine gets absorbed into the cotton balls instead of the diaper, and you can take a syringe and actually suck out or aspirate the urine from the cotton balls into a syringe, and then you can drip it onto a strip, like a urinalysis strip, to check your urine that way. So that's good for small, frequent amounts of urine. Did I answer your question? Okay, perfect. No problem. So that's a great question, Carol. Really, breastfeeding is a great time to teach parents about, breast self-exams. They should be getting taught this annually every time they go, or seeing if they're doing it. Honestly, I can't even tell you. I go every year for annual physicals between my OB, not an OB, oh no, GYN. Between my GYN and a regular provider, and both of them do breast exams, and not one of them asked me if I actually do it myself. I just thought about that. I know, TMI. But that's a great opportunity for teaching about breast self exams. There's really not anything different to teach them as far as breastfeeding in general. It can make the breast tissue a little more dense when you're breastfeeding, and it can be firmer, so it may be harder to detect lumps, for example. But teaching them a good time to do a breast self-exam would be after feeding, for example, when their breasts are empty, so there's less risk of that dense tissue covering up any kind of lumps that may be. But absolutely, just telling them the same thing we would normally tell them. I mean, it may, with stimulation, cause leakage of milk from the breast, but if they're breastfeeding, that stimulation is great because it's going to help promote more production. Great question. So ATI says ATI says you can start using the numeric scale at age 5. So go with ATI as far as learning your information. However, I will tell you in practice, my experience is more like 8, maybe 7 in an advanced child, but more like 8, where they can really understand the differences of numbers on a number line. But ATI will tell you 5. And then for yeah, that's exactly why you probably wrote 5 and 8. Yeah, so go with 5 because that is what ATI says. But I don't know of any 5-year-olds that can do that and understand what truly the difference in 2 and 8 means as far as on a pain scale. Adults don't understand that. So, I mean, as far as, no problem. As far as the faces scale, where you have the pictures of the faces and you tell them point to which one you feel like, that one you can start at age 3. So if they're under 3, you have to use a behavioral scale. The most common one we use as far as the behavioral scale is the FLAC, the face, legs, activity, cry, and consolability. And there's a few that your book talks about. They talk about the NIPS scale, which is similar, except you use it for neonates. There's something called the CRIES scale, CRIES. But when you're learning your scales, I want you to learn 3. The numeric scale and what age, and learn 3, what they mean and what ages you use them for. The numeric scale, the faces scale, and the FLAC scale. There is a few other ones, but those are the most common ones you see. And I don't want you to memorize, so I told this to the day class, but just to reiterate, I do not want you to memorize the FLAC scale. I know with APGAR, I told y'all you need to memorize this and you need to be able to analyze an APGAR and figure out what it is. You don't need to do that for FLAC. You don't need to memorize the different components and give me, say, a pain scale based on that child's behavior. Just understanding what it is, what ages you can use it for, that kind of thing. So really, FLAC scale, you could use it for any age, especially if you're talking about older children. Maybe they're developmentally delayed. Maybe they had a procedure and they're sedated, so they're not going to be able to really interpret the faces or the numeric scale. You can always go up. You just can't go lower. For instance, you can't use the numeric scale on a 4-year-old because it's too low, but you could use the faces on an 8-year-old if you needed to, like if they're delayed. So the lower barrier is what you need to focus on, not so much an upper barrier for numeric scales. Absolutely. Let's see if there's anything else. As far as interventions for pain, I didn't really talk about this in class. Your interventions, for the most part, are going to be the same as adults. There's some things we do for infants you don't do in adults, like swaddling, for instance. That can be a pain measure. The non-nutritive sucking, like using a pacifier. And a lot of times we'll use the Sweeties with it. If you've seen it, it usually comes in a little cup with the pull thing off the top, and it's just sugar water, and you can dip the pacifier in it, and it's calming. They'll use it a lot during circumcisions and stuff like that, so you may have seen it if they've used it during then. Rocking and holding, those kind of things. But a lot of our pain interventions are going to be the same for adults versus children. They don't really change too much. Medications, we have far less pain medications that we use in children. We don't use Dilaudid in children. I know Dilaudid is a common, frequent narcotic that we use in adults, but it's not used in children. Very rarely have I seen it. It's always been in teenagers. Even in teens, where they prefer either fentanyl or morphine. And the reason for these two, there's different reasons why we would choose morphine versus fentanyl. Morphine is great as a drug because it has less side effects typically than the other opioids. So children are much less likely to have adverse effects to morphine than the other opioids. So that's one we use. That's probably the most frequently used one. The second one, fentanyl, the reason fentanyl is a secondary good choice is because it has a really short half-life, which means it will get out of their system faster. Let's say they're not tolerating the dose. Maybe it was a little too much for them. It's going to get out of their system a little bit faster. But also it has a rapid onset too. So especially if you have a patient that's in a lot of pain, fentanyl is good because it will kick in a little bit faster than morphine usually. Not by long, but maybe a few minutes. Other medications that we use, Tylenol and Motrin, or acetaminophen and ibuprofen, are the two big choices that we use. Another one that we use, it's very common, is Ketorolac or Toradol. Make sure you know Ketorolac. Ketorolac is important. Toradol is important. We use that a lot. They're even starting to use it now as an antipyretic. When they're admitted, they will give intravenous Ketorolac. Alternating that with Tylenol instead of alternating Tylenol and ibuprofen as an antipyretic, and it works really well. The biggest drug we don't give that's over the counter in children to the general population is aspirin. We don't use aspirin in children. I'm sure y'all have heard that before because of Rye syndrome, especially when they have an illness, specifically varicella and flu. But we just instruct the population to stay away from aspirin in general. Now, there are specific circumstances where that is different. But for instance, when you're listening to the musculoskeletal lecture, I talk about rheumatoid arthritis. We use aspirin for rheumatoid arthritis in children, rheumatic heart disease, anything rheumatoid-like usually. And then there's another one with cardiac Kawasaki's disease we use aspirin for. But as a general overall rule, except from very specific circumstances, we don't use aspirin. So acetaminophen if they are for any age, ibuprofen if they're over 6 months of age, Ketorolac if they're over 6 months of age. No Dilaudid, no aspirin. Morphine and fentanyl are great drugs. Morphine for decreased side effects, fentanyl for quicker onset and decreased half-life. No, great question, Kathy. So actually none of them, well, hold up. Hold that thought. I don't know that any of them, did I put the links in there? You know what? Let me share my screen and y'all can look with me. There it goes. All right, so this is week 7. Yes, week 7. So when you first go into week 7, you see all the growth and development stuff, the terms, the growth and development handouts, the templates. When you click on care of the pediatric patient, all the way at the bottom, this is the stuff we talked about today specifically. So the recorded lectures for the information we talked about today as far as communication, assessment, sensory disorders, pain, all that stuff, then there's 2 of them. They're under here. And then the PowerPoint that goes with it is right there. And then the worksheet, the one I was going through today while I was answering questions from it in class, that's located right here. So everything we did today is under week 7. Now, if you go to week 8, let me make sure the links are there before I tell you otherwise. So week 8 is where you'll find all the neurological, neuromuscular, musculoskeletal stuff that we're going to talk about next week, the ones that I would like for you to listen to before you come to class so we can discuss it. So now I uploaded that worksheet here. Where did it go? I don't know. I'll go back and find it. No, oh, this is the evening class. I hadn't put it in there yet. So for evening class, I'm going to upload that. There'll be, so your recorded lectures for all the neuro stuff is here under week 8. In just a minute, there's going to be a content worksheet under this that's going to relate to all the neuro stuff. So between week 7 and week 8, you'll see all the links that you need for the stuff today and then the stuff for neuro for next week. Okay, wait a minute. I don't know what this thing's doing. Good. Okay. Let me, while I'm thinking about it, put that document in the evening class. I forgot I hadn't added it. I don't know why it wasn't in either class before. And I said I'd put it in the day class, and then I said I was going to go back and do the evening, and didn't. All right, perfect. All right, so you'll be able to see that there now. That goes with the neuro stuff. And then if you don't want to, oh, I know what it was. If you don't want to use the links, if it's easier for you, you can just go directly to YouTube. I would even say subscribe just to make it easier to find everything. I'll show you mine. Sharing again. So if you go to this, there's tons of uploads here. So the ones you see at the top that say tutoring and have a date on them, those are recorded tutorings from last semester. I encourage you listen to them as well. Some of them have Jeopardy included. Some of them are just question and answer. It just varies depending on the day, but they often, you see here when we were doing cardiac, I was drawing a picture of cardiac disorders like tetralogy of Fallot. So the ones you see tutoring and then a date, those are tutorings, recordings from last week. Then as you scroll down, you'll see the recorded lectures. So some of them that you already know of from the first week, peds, respiratory. So there's 2 neuro sets. There's one that says neurological, peds, neuromuscular, musculoskeletal. This is the one y'all want. This one right here with the darker gray background, it says PN. Now, y'all are welcome to listen to this, especially with the musculoskeletal. I go into more detail on that one. But for the most part, y'all's that doesn't say PN in front of it is going to have the more detailed information. So you're welcome to listen to both, see if maybe there's something you get out of one and not the other. But the one with the lighter gray or whitish background is the one that's going to be for y'all to give y'all more information. So as you scroll down, there's several videos. There's cardiac and hematology. Every single pediatric lecture from here on out is on here. Every single topic we're covering has been pre-recorded and is on here. So if you want to start listening to stuff ahead of time, you are welcome to do that. They have all been pre-recorded. There's one, so these 2 down here with that pinkish and bluish swirly background on the edges, these are the 2 from the information we covered today. This is the video I keep telling everybody, and I've mentioned it in class a few times. This is a video that tells you how to break down an NCLEX type question. So it goes through and gives examples of techniques that NCLEX uses to eliminate answers, like therapeutic communication, using assess and lessen distress, using your Maslow's hierarchy of needs. It goes through and talks about it. It's a little over an hour. If you have time, I would say look through this. This can give you techniques of how to narrow down answers. Because with NCLEX questions, that's where people struggle, because it's not just knowing the content. The content's important, but it's also understanding how to use your critical thinking to answer those questions. And sometimes you cannot know all the content, but be able to answer it based on using techniques to eliminate some of the other answers. So this is what it looks like. The ones with tutoring have a date with them, but the ones that are recordings of actual straightforward lectures, those are not dated, but they'll have the topics there. And I tried to put multiple ones for each week so that it's not one big, long 2-hour lecture or whatever it is. So either way, you can use the links that are embedded in week 7 and week 8, or just go directly to YouTube. If you're looking for me, my name in YouTube is Amy Martinez RN. And I have like a purple A is my icon. I don't have a picture up for mine, but oh good, I'm glad it's helpful for you. It started that way unintentionally, like when we would miss classes for, whatever reason, like one night, this was a couple years ago. Do you remember a couple years ago when school actually closed, which you might not have paid attention because y'all wouldn't have been at Bryant Stratton, but when we had that hurricane and then we were having all those tornadoes. There was a big one on Hull Street that happened. They had closed down school for that, so class was canceled, and so things like that. I recorded it since we were missing class, or we'd have holidays like Thanksgiving or whatnot, and it's built from there. Gosh, that was a couple years ago. I didn't even think about that was that long ago. I remember, funny story, the day all those hurricanes happened, I was out at Cumberland that day, just so happened, and I mean, it was beautiful out there. Sun was shining. It was great. I come back home and I'm hearing all these tornadoes and all these horrible things that have happened. I'm like, oh my gosh, what happened? I had no idea until I left. Yes, my husband had to go. He was picking up the kids that day because, of course, I was at Cumberland. When he went to the school to pick up the kids, he was kept at the gym for a few hours. They wouldn't let anybody leave. I remember that. That was crazy. And then I figured last semester, with everything being virtual and me recording tutorings, might as well leave them up because you never know when somebody asks a question that might help somebody else or whatnot. I know tutoring doesn't always fit in everybody's schedule. I try to put it in between classes, so potentially I could reach the most amount of people between the day and the evening. But if you have the recordings, that way, if you can't be there, it's at least some kind of benefit. Oh, good. I'm glad. Yeah, some of them are probably more helpful than others. Sometimes they were more information going on, more questions, more back and forth, but all of it has some good information. And the biggest thing I can say, I know this is unusual the way our exams are now going to be, 3 exams back to back. Stay on top of it. Don't wait until right before the second exam or right before the third exam to study because it's just going to get too close. So just study at least an hour every day, even if you're just reviewing information, looking at flashcards, listening to lectures. Reading, which y'all know how I feel about reading. Reading is great to get you the information, but it doesn't help as much with retention, or at least it doesn't for me. Adaptive quizzing, using practice questions and things like that, that will help keep it in your brain. That's why I try to give y'all stuff to do while you're reading too. Things like the exam objectives or like the content worksheets or things like that. So you're actually doing something while you're reading. You're writing down information instead of just staring at a page. Y'all can do it. I have no doubt, Heather, that y'all can do it. It's just a matter of staying on top of it. And I know this is, you are probably rolling your eyes at me, and that's okay. I understand. Um, but we do have to make the best of it, and we can absolutely do it. Just don't let it get behind you. I know it's an unusual circumstance, and I'm really sorry for the circumstances. You have no idea how sorry I am that it has to be this way. Um, but you know, it is what it is, and we're gonna make it. We're gonna make it happen. Whatever we got to do, I'll do what I can for y'all within my realm of power, which isn't much usually. But just stay on every day. I want y'all to be doing something. Do practice questions, review lectures, do something, even if it's just an hour, even if it's before you go to bed, you lay in the bed and read a little bit or listen a little bit, listening in the car. Um, you know, we will get through it. People have said, do you mean you've been doing adaptive quizzing for peds? Is that what you mean, or just because you've seen that there's so much peds content? Oh, okay, I got you. Students who have done the adaptive quizzing, now I know it doesn't work for everybody. Don't get me wrong. I know everybody's different, but students who have done the adaptive quizzing said it has been very helpful for them, for especially OB. I've had some people with peds that say that didn't help me at all, but which I'm not sure because a lot of times it's the people that got a level 2 that say that. But with maternity especially, people have said it's been really helpful. That's what I like about the adaptive quizzing too. It gives you the rationales, it gives you the correct rationales, it gives you the incorrect rationales, so that way you can learn the information. And I would say as you're going through, write down the rationales. Or I know it won't let you copy and paste the questions, but I think somebody told me before it will let you copy and paste the rationale. So if you make a document out of those, to help you review just the rationales, and learning that information, because a lot of students have told me they'll see a question in adaptive quizzing, that then they'll see very similar question on the proctor, but it's been changed around a little bit, so one of the previously wrong answers is now the right answer. Yeah, exactly. Just be careful. The only thing I would warn you about pictures, Heather, as you know, ATI puts out that their information is copyrighted, which it absolutely is. Be careful if you're taking pictures. Don't share them with anybody. Don't post them anywhere. I've had students, and this was a long time ago that it happened, but I've had students that they would post pictures of questions on Facebook of ATI questions. I'm like, oh, you got to take that down because it is copyrighted information. So if you're doing that, just make sure that you are keeping that to yourself. Yeah, and I could see that using them like flashcards. Just be careful that you're not sharing it or anything like that. That's how Kathy Parks got in trouble, is she was using, and I suspect when she was just doing YouTube videos, it was fine, but once she started making products based on ATI information for profit, that's when it came back to bite her in the behind. But yeah, just be careful, not sharing that or anything. But yes, I agree, using it, like you say, like flashcards. And I also like with adaptive quizzing how even though it's 400 questions, each time you go in, you can pick that you only want new questions that you haven't done, or you can pick questions you have done that you got wrong to go back and do them again. It lets you really customize what you want to do. Another resource that's good for practice questions that I like is on the Evolve website. If y'all bought the Saunders book, the practice, the NCLEX prep book that we usually tell you in fundamentals to get, some people get it, some people don't. There is an online component to that, and it lets you customize practice quizzes in there as well. So that's just another avenue of practice questions. It even lets you pick like select all that apply, or all hard intensity, or whatever it is that you want to do. All maternal newborn, for example. Let's see. I'm trying to think if there's anything else. Growth and development. Make sure, I cannot stress this enough, make sure y'all go back and review your growth and development stuff. I've already mentioned it a couple times, but use those ATI templates. Fill those in with your growth and development information. They will help you immensely. Use those study guides. So I'm personally one that I do well with study guides. It's just something I have to fill in. Helps. It's kind of that hands-on application and reiteration of information. So those study guide pages I posted in week 7, use those, print those out, and fill them out if it helps bring back the information. I like something I can do, either practice questions, filling out information, handwriting. I do better with handwriting than typing as far as retaining. So if kinesthetic knowledge helps with you, meaning something you have to do that's hands-on to get it in your brain, those templates will help, because it'll help you go through and write down the information. there's anything else. Do y'all have any questions for me? I know you probably don't even know what to ask me very much. Not at this point, anyway. And this today and next week will definitely be posted on YouTube as far as being recorded, as far as tutoring, so you can find those for class. I do record the classes, so if you're looking for actually what we did in class, you'll find those on Blackboard Collaborate under recordings. When you go into Blackboard, instead of where it has sessions at the top, you click on recordings, and it'll pull up any previously recorded information. Y'all have anything for me? Okay, good. Absolutely. Yeah, use those resources. Do the exam objectives too. People that did them for the first exam said they were helpful. It helped. I would say use them when you're doing your readings. Go through and fill out the information when you're doing your readings. I love adaptive quizzing though. Absolutely. I want y'all to have everything that I can. Doesn't always work out, but I try. I try to give y'all any extra resources, and this is years of accumulation. So, you know, if you had me 4 years ago when I first started, it might be a different story, but and I know that different people, and I also try to give y'all different types that I don't require because I know different people learn different ways. So if I can give 3 or 4 different things to do, but you don't have to do them, you can find which ones work for you and utilize those methods instead of doing everything just that's busy work that doesn't work. So I'm glad it's helpful, and even in the most unusual of circumstances. All right, guys, if y'all don't have any questions for me, I won't hold you up because I don't want you just to sit here and stare at my face for an hour. um, but please email me when y'all have questions. Please let me know when y'all have questions, concerns. I'll clarify. We'll do this again next week at 4 o'clock. Same deal. And then of course class as well. Clinical if I have you this Saturday or Monday. Absolutely, you're welcome. I will see y'all either tonight if you're in my night class, or if not, for the rest of you, I'll see you either Saturday or Monday or Thursday. I'll see you sometime in the next week. Bye, y'all. Have a good night, or I'll see you in a little bit.